We have problems. The kind of problems that can screw a growing specialty are political problems. Problems with image, problems with spin control. So, once upon a time, a gynecologist did vaginal repairs, and the patient said, sex is better. It was done for gynecologic indications, but the patient had a friend. Friend didn't have gynecological problems, but she had some laxity and told her about David Matlock, who had just done this gynecologic indicated repair. So she comes to the office of Matlock and says, how about you do me, because I want better sex, in 1996. And this was the guy that said, all right. And vaginal rejuvenation was born, the surgical kind. It wasn't born out of ACOG, academia, anywhere else. It was born out of this guy in Beverly Hills who was also doing lipo and other things. So, as you might imagine, it was off to a very controversial birth. And the people that joined the bandwagon were people just like us, early adopters, innovators, neophiliacs who love this stuff. So, we don't have the same level of fear. We have a higher risk tolerance. Witness your presence here. Who in their right mind from ACOG would come to a meeting in the middle of an outbreak where they're closing airports left and right? Right, you're here, man. You're a different breed. So we're the 5%. We are the, significant, P.001. Okay, we're different than them. So they want data before they feel confident doing anything. These are the people that read the instructions before they use something. These are the people that do the, analysis paralysis. That's not us, but they happen to be in the majority. They have a big mouth. Every so often they write things that are bad for the specialty. So it's hard to argue with lack of data. I mean, you can criticize them all you want. But sooner or later, what you're doing has to be backed by some kind of data at some point. Okay, we've got innovators galore. And the difference between an innovator and a user, innovators tend to be skillful, smart, and these are the ones that they do something risky and they get away with it. Because they're very skilled, they know how to pick the right cases, and somebody who copies them and doesn't know, well, he would never or she would never do it on that kind of person, are the ones that wind up burning a hole into something that wasn't supposed to have a hole in it. And gives the technology a bad name and makes the whole procedure an easy target for the academics. They're like, look, they're making holes in the rectum. So you don't judge a procedure by imperfect technique, but if all you have is imperfect technique, you have a problem. And that's the problem with dissemination. Okay, the whole behind that wall is a whole industry there that lives to sell products. Now they've learned, they've been bashed by the FDA for marketing, but that doesn't stop them from selling things. So our job is to sort of make sure that the people that use these things know what they're doing. So when we have this invasion from uneducated people, they're not winding up getting treatments for pelvic pain when they have an ovarian torsion with a laser because the doctor says pelvic pain is pelvic pain. Okay, they're getting mistreated. You know Naomi, right? She's the 21st century woman who thinks she can handle all of her educational needs with a cell phone. She knows it all. She gets the Uber, she gets the restaurant, she gets the airplane tickets. And when she has pelvic pain, she knows what's wrong with her because she went to Dr. Google and she finds this guy, Dr. Tango. Dr. Tango is not a gynecologist. He's a flashy internet celebrity doctor with all the latest machines and all the latest treatments who offers them up to anybody who shows up at his office. Okay, you got pelvic pain? Well, I haven't done a pelvic exam since med school, but I'll treat you. It's not a problem, I'm cool. I got hits, I got followers. So he turfs the patient off to the assistant. who he just hired yesterday. She's maybe 21 years old, doesn't know anything more than how to turn on the machine and fire the button. So the doctor doesn't examine the patient. The one providing the treatment doesn't know medicine, surgery, anything. And you wind up treating people just by the name of the problem instead of the actual reason for the problem. Could have anything wrong with her. So if she comes in with pelvic pain, it's undiagnosed etiology, and all you're treating is a word because there's a word that says that word is sometimes associated with improvement with these machines, you get an unhappy patient. She winds up going to a real doctor, gets diagnosed with chlamydia. So this is the problem that you have. You have ignorance, you have the internet, and you have Dr. Tangos floating around. Okay? So when Dr. Tango does vaginal rejuvenation, that makes my vaginal rejuvenation, your vaginal rejuvenation, and yours look bad because the academics are lumping you in with these people. They don't like you to begin with because you're making money. So it's just another thing to hate about you. They're going to lump you all together. So what we have to do is we sort of have to be the police for these things and differentiate ourselves by excellent results. That's the pie. Okay, our little piece of the pie is less than 1% of all specialists who are educated in these procedures in cosmetic gynecology. But we are not the only ones buying machines and doing treatments. That's the problem. That's the problem. So the problem with the people that do these who aren't qualified is they look at them and they say, this looks easy. It looks so easy that I think I can do it because I can do a 15-minute C-section, or I can do a 15-minute gallbladder, or I can do a little TURP. And I'm good at other stuff. So just because of that, I'm good at anything that I do. It's what I am. So it's not dangerous. Okay, I cook a vagina with a laser, radio frequency, HIFU. It doesn't matter. You're not going to hurt the lady. Well, you're going to hurt her financially. Okay, you're going to give her a treatment maybe she didn't need. If you have an ovarian torsion or chlamydia, you're not going to do anything more than delay the diagnosis. And you don't know how to use anything. You're just a machine buyer and operator. You don't know anything about patient selection, so that makes you bad. You don't know anything about the treatment options. Maybe there was something covered by insurance that was better than what you're providing, but since you don't know anything, how would you even know the option exists? You don't know anything about strategy. And you start spewing out features instead of benefits. Oh, look, I have this technology, it's made in Germany, blah, 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 blah. What does it actually do? Oh, it makes you feel better. Well, good. It doesn't mean anything. Oh, I want to get the procedure because everybody's getting it. All right. Yeah. No, it's not an indication just because other people are doing it. You have to educate the patient. You're not getting a treatment. You're fixing a problem. This isn't like keeping up with the Joneses that everybody should have a sling. Everybody should have this and that. And just because it's cheap doesn't mean it's okay to throw your money away. It's really not doing anything. Just because it's safe. And then the fuzzy words. Okay, patient comes in, I want vaginal rejuvenation. You got to sit down. You got to figure out what they mean by vaginal rejuvenation because it doesn't mean anything. So if they come in and say, I want vaginal rejuvenation, and just throw a laser in there, you don't know why you did it. She doesn't know why she wanted it, and we don't know what happy is. Feminine health, what does that mean? Feminine wellness? It's just vague, nebulous terms. So you got to educate these people, or just run them out of town. Just run them out. You got to tell the patient. The patient comes in for a procedure. She has been brainwashed by the whole industry. So I have to re-educate her and tell her that half of what she's got is marketing materials. The other half is 5-star reviews that were like 1 in 100 people with these super reviews. And the rest is a bunch of BS. So you have to educate these people because their expectation is way high because they read it somewhere. They bought into some story. So we have to refocus. And when you get the expectation down to realistic, that's where the happiness is. If I tell you it's going to do X, and you're thinking it's going to do X squared, you're not going to be happy, no matter how perfect the result is from our standpoint. So we have to redefine success. Okay? We're fixing things. We're not selling procedures. Sure, you have to sell yourself to get the patient to come to you for the fixing. But, you're not going to apply hard sale, pressure techniques on people, forcing them into procedures they don't need because they trust you. And if you start hard selling and you don't get good results, sooner or later, it's going to kill your reputation. And you're looking at these people for long term. It's not like, I just want to pop off one procedure and be done with you. I want to be your coach, for the long term. That's where the real business model, that's where the real long-term clientele, that's what, successful businesses all do. So don't think of them as customers, think of them as clients. Because if you don't, okay, you're going to be having the copycats getting bad results, and you're going to get a bad name, and that's going to kill you. Your technology is going to be just a waste of money that nobody's using. Patients aren't going to be happy, and you're not going to be happy. So with that cheery thought, we will take a coffee break and be back at 4:05.